I'm a nursing instructor at City College of San Francisco, which is an associate degree nursing program. Actually, I got a hold of Sue Hassmiller, who's directing the whole project from Robert Wood Johnson Foundation. I have a statement from her. Campaign for Action is a multi-year initiative to advance comprehensive change in healthcare for patients and the country by fully utilizing the expertise and experience of all nurses. On both national and local levels, it will advocate and support actions that enhance nurses' ability to contribute as essential partners in care. The campaign already has elevated discussion of the role and potential of nurses, as well as energized regional coalitions of nursing groups, other health professionals, and consumer advocates that are working to implement changes in targeted states. The real change to nursing practice will happen when payment reform happens. The mechanism to change nursing practice is in place, and it is actively happening, and it will happen. We're just not exactly sure how much and where and when. The timing is kind of, we'll have to wait and see. There seems to be quite a bit of consensus around a big takeaway point from the report. I mean, 4 out of the 8 recommendations have to do with education. So become a lifelong learner. And what does that mean? That means you keep going back to school for more advanced degrees, because that will give you the skill sets and the tools to be able to take care of, to be a really great nurse of the future, taking care of the healthcare needs for future patients in a reformed healthcare system. We need a lot more nursing educators. You've heard probably a lot of press about the nursing shortage, but there's very little press about the perfect storm, which is the faculty shortage. I think the beauty of nursing is the multiple entry points. We're finding that you have community colleges in so many different geographical locations, and they are cheaper than the 4-year university generally. So many people choose to come in at the associate degree level. Another good entry point for someone with a baccalaureate degree is an accelerated RN to master's program. So it's an entry-level master's program. I think the ADN degree will be around for at least the next 100 years, personally, for a couple different reasons. One is, have you looked at the nurses around in your community lately? We're all getting much older, and we're getting near retirement. And so I kind of foresee this massive exodus of nurses and nurse educators out of nursing and into retirement. And I don't know about other communities, but here in San Francisco, many nurses hold 2 full-time jobs. They'll work one job and then go work at another. And so they're taking up 2 jobs. So when they retire, that will even accentuate the shortage, because they're not just leaving one job, they're leaving 2. If you look at the diversity across LVNs, licensed vocational nurses or licensed practical nurses are what they're licensed as in some states, their levels of diversity more closely resembles the diversity of the population than the than RNs. So it makes sense in the future to have more LVN to RN programs, or LVN to BSN programs, or LVN to master's programs in nursing. So we're going to need all nurses, no matter whether they have an associate degree or a baccalaureate degree or a master's degree or higher. I know about bridge courses and bridge programs, kind of like to get one cohort into a new educational track, and perhaps it's a 1 to 3 unit course. And those are fine as long as they're bridging you to something really good. So if they're bridging you into a program where you're taking the same coursework or the same subject matter and you have a lot of curriculum redundancy, it's not a very good program, because it wastes your time and your money. If, however, it's something seamless, like Oregon Consortium of Nursing Education, where community colleges linked up with the university system, and they collaborated and developed consensus regarding the curriculum so that the first day at the community college nursing program is the first day of the baccalaureate curriculum, and then you're co-enrolled between the community college and the university. You don't have to fill out, more forms. Your financial aid follows you. They share resources, they share faculty. That is like the dream education consortium. So that's like becoming a role model for the United States. Go for your master's any way you can, and if you can take the time to really plan for it, spend a lot of that time looking for scholarships, especially if you want to go into nursing education. I've noticed with my career, the higher level degree I have has opened up more and more leadership positions, and I think I've noticed that with other people as well. I kind of picture hospitals being big intensive care units because everyone else is being so well managed in their community, in their homes, and we'll see a greater use of technology. I kind of see like things like Skype and maybe perhaps, Twitter, Facebook, maybe populations will be connected to their healthcare providers in many different avenues that we haven't explored yet. So definitely the use of technology will come into play. We need reforms that eliminate curriculum redundancy and make going on for your baccalaureate or master's value added. It's not, we owe something to nurses who go on for a higher degree. So we have to make it worth it for them. And I think the person that's receiving prevention or primary care will be much more involved with their health and their health care management. There'll be this pull to get them to really be part of the care team. We talk about that now, but I don't really see it in my practice as much as I'd like to see it. So that's going to probably be a big change. Well, I think there's fabulous opportunities, and I'm just so biased because I love it so much. Come on in. We need you. We need you because we need really great nurses to take care of, your mom, your dad, your friends. So we really, it would be devastating to, I think, this population if the nursing shortage worsened. The other thing is, it's fabulous taking care of other people. I love participating with healthcare and taking care of patients. The way the practice is now in the status quo, it's a fabulous place to be. I get to spend hours with my patients, and it's so great at the end of the night to reflect on what I did at the hospital or my practice with my nursing students, and the great conversations and the great outcomes, and just kind of taking the journey with them, whether they're nursing students or patients in the emergency room where I work. I love that, and I'm real excited about the future. I'm excited that we'll be able to have more of a collaborative practice. Well, right now it's difficult to find a job if you're a new grad, just like it is in all professions. So I would say be as mobile as you can, especially for the first 2 years. If you can get your staff nurse 2 is usually what it's called on the West Coast, or at least 2 years of experience in an acute care setting, but be open to other settings as well. What I tell all my students, don't just come into nursing. Come into nursing and take what nursing has to offer, but offer something back. Get involved. Join your professional organization and volunteer in your nursing community. So whether it's helping to put on educational courses, working with other nurses, do something back for the profession. Don't just come in and make a great living and have a great career. Give something back. Do something in leadership. Volunteer.